Are you caring for a parent or other family member who is struggling with a serious illness or end-of-life diagnosis? We often think of burnout as associated with extreme job stress, but an often overlooked type of burnout is caregiver burnout. Today, we will be diving into what to expect as a caregiver and how to take care of yourself in the midst of caring for others. Welcome to the Rekindle XM podcast, where we talk about managing stress, recovering from burnout, and living a life of passion and purpose. I'm your host, Michelle, and I'm joined by my co-host, Brian, and our special guest today, Sammie Stephens. Masha, our other co-host, couldn't be with us today, so we will miss her, but we expect she'll be back for the next show. So Sammie, you're an adult geriatric nurse practitioner. You have over 20 years of experience of both the clinical and administrative side of healthcare. She has a Master of Science in Nursing from Walden University and a Bachelor of Business Administration from New Mexico State University. She is also a graduate of the Real Balance Global Wellness Coach training program. In 2015, Sammie established a health coaching program for a Level 2 trauma hospital in Wyoming. The program aimed to improve health and decrease burnout. The following year, she played a key role in developing an integrative health clinic at the same hospital. The clinic focused on helping community members reduce the risk of heart disease, diabetes, and stroke. More recently, she served as a nurse practitioner for seniors, providing compassionate care to patients in various locations, including skilled nursing facilities, assisted living facilities, and private residences. In 2022, Sammie started Vivec Health to help family caregivers understand and navigate the healthcare system so their loved ones can get the care they need. So Sammie, thank you so much for joining us. You have a very impressive background and just wealth of experience in both healthcare and in geriatric health. We are just so privileged to talk to you today and discover more about this really important topic of caregivers and how they can also help take care of themselves in the midst. I think Brian and I and Masha as well, we've actually all gone through recent experiences as either primary caregivers or secondary caregivers. And there's so many things that you just don't think about, you don't realize until you're in that situation. There is a lot of stress, and there's also some tremendous blessing and reward, but we're just so thrilled to get your perspective. So
thank you, Michelle and Brian. Sammie, I'm so happy to be here with you today. Thank you for having me.
Absolutely. So Sammie, before we get going with some more in-depth questions, just tell us a little bit about your current business, Vivec Health, the services you provide, and what was it that really kind of drove your interest into going into that business?
So it's Vivec Health. It's actually a Spanish word. It's the Spanish word for bivouac, it's a term for temporary shelter. And that's often used for mountaineers when they're climbing mountains, or for soldiers when they need a temporary shelter. And often when someone's dealing with a chronic health issue, they talk about climbing a mountain or soldiering on. And so we chose that title because that fits what family caregivers are often doing. And so that's really who I serve, is family caregivers. And we all know that family caregiver who is just pulling their hair out, trying to make sure their loved one is taken care of. And so I come alongside that family caregiver and help them to get organized, to understand and navigate the healthcare system so that their loved one can get the care they need.
And Sammie, how did you decide to get into this business? You've obviously had some experience in a number of settings, but what was it that really drove your passion for this?
Well, I'm an adult geriatric nurse practitioner, and I was working directly with patients in several different settings, in long-term care, assisted living, and then also in the home care setting. And I would ask family caregivers, how are you doing? And I kept hearing the same answer over and over. They were exhausted. They were frustrated. They felt overwhelmed. They worried that they might be missing something in their loved one's care, and they weren't sure how to advocate for their loved one, and they just felt like they were trying to do everything by themselves. And then I became a family caregiver for my mother, who went into hospice care, and then for my sister, who was in assisted living and then in skilled nursing care. And through those experiences, I knew I had to reach out and help family caregivers. And so that's really what led me to start this business.
And I'm so glad you're doing this. I mean, I think if you've been through this, where you've cared for a family member, you realize there are, like you said, there's so much frustration. You feel overwhelmed. My dad was the primary caregiver for my mom, who had a 3-year battle with cancer. And, there were just so many points through that journey where you didn't know what to do. You didn't know what questions to ask. You didn't know how to get, the care or who to talk to. Like, it's just so complicated trying to navigate it. So I'm so glad that you provide this service, because, yeah, I can, from personal experience, I can say that it is a complicated system, and trying to navigate that is difficult.
It truly is. The healthcare system, I mean, for all the things that we've tried to do to make it less complicated, it is confusing. To someone on the outside, it is confusing, it's complicated, and it leaves the patients and family caregivers just feeling overwhelmed and frustrated.
Yeah.
And so,
as
my goal is to help them get the care that their loved one needs without all the overwhelm associated with it.
Yeah, and it's interesting that you use that word overwhelm, because that is often the same word that people use for other types of burnout. So whether it's professional burnout, caregiver burnout, but that feeling of just being completely overwhelmed and exhausted, like those are the terms that we hear so often. And yet I think perhaps we tend to overlook this particular, when you are a caregiver, I think we tend to overlook that, and that can by itself lead you into such that high stress and potential burnout situation.
Absolutely. Absolutely. And I just want to mention a podcast that you all had recently. Was it Dr. Shannon? Was that her name?
Yes.
Yeah, that's an excellent podcast. So I would just encourage anyone that's listening, if you haven't listened to that podcast, go take a listen to it, because she's talking about physician burnout, but it impacts anyone within the healthcare system. So nurses, nurse practitioners, physician assistants, and if you're not someone that's working in the healthcare system, it might be easy to say, well, that doesn't impact me because I don't work in the healthcare system. But it does impact us, because as family caregivers, burnout within the healthcare system impacts the quality of care that our loved ones receive. So it's really important that we have an understanding of that level of burnout that's happening in healthcare.
That's a really good call out.
I think there's a disconnect. Well, there's not a disconnect. I think the problem started is when burnout first was diagnosed as a medical or physician stuff back in the 70s, that nobody places it anywhere else. And you don't really think about stress is different than home stress, is different than caregiver stress, but nobody puts that all of it is stress. And when it all starts to combine, it doesn't matter where the main stress is coming from. If you're getting stress from all sides of it, it's still combining and adding in, and you just have less capacity to deal with the more stress that you're taking on. So that's where I get a little frustrated with the burnout term now, because I kind of feel like it needs to expand, and I don't know that it will, because people just want to place it in the work.
Well, and you call out something, Sammie, that's really interesting, which is, so I come from the healthcare field as well. I'm not a practitioner of any type. I've always been on the operations and the research side, but you're correct, because being part of that, and you hear about how overwhelmed often our physicians and our nurses are, who of course are the ones who are caring for your loved ones or helping you care for your loved ones. And when they're stretched, then there is absolutely kind of that domino effect, because they may not have a lot of time either. So, it's right. You're right that there is this cumulative effect. And then the other piece of that is we don't think about if you are in a really demanding career and then you put the caregiver role on top of that. Sometimes there's a layering. Sometimes burnout happens because of a combination of factors. In fact, we just interviewed in last week's podcast, the podcast that aired just before this one, we talked to a very successful businessman. He was a young millionaire. He was doing well and successful in work and in life. He was podcasting, like he was doing all of these things. He was doing extremely well when his dad had a stroke. And then all of a sudden there was this downward spiral because in his case, it wasn't just a matter of caretaking. It was he left the country because his dad was out of country to go take care of this. So the rest of his life felt like it was going to fall apart. So there's just all of these layers that kind of add up and come in that we just don't often think about. And I'm really curious about your experience, particularly with caregivers. What are some of those additional roles, responsibilities, tasks, or just emotions, decisions? Like there's so much that goes in. What are the unexpected things that often come along with being a caregiver?
That is such a good question. And I will give you some specifics, but I just want to start by saying generally, it all ends up being unexpected. And I don't say that flippantly. I say that because in our culture, we don't typically we don't plan or talk about the fact that we are going to age, we are going to have illness, our loved ones are going to age and have illness. And because we don't talk about that, we don't plan for it, which means when it happens, it can feel unexpected. And so the emotions that come up, the things that need to be put in place to care for someone can seem unexpected at that time. When I see someone that is caring for a loved one in the home, just in terms of something that can be unexpected, when someone is caring for a loved one in the home that is very ill, they may have home care, hospice come in and work with them. And what I feel like caregivers don't often know until they find themselves in that role is that when hospice comes in or home health comes in, they're going to come in and provide support, and they may be there 1 or 2 hours a day. And then the family caregiver is going to be responsible for taking care of the needs of that loved one for the other 22 or 23 hours a day. And they're often not expecting that. So that can be surprising, and it can be emotionally overwhelming, but it can also be very physically demanding. When someone is at home and they're if they have a hospital bed, for example, if they need to be in the hospital bed and it elevates, which is great, that can help somebody breathe better if they're having difficulty breathing. But the family member is going to need to help move that person up in bed. And if they don't have a lift in the house to help with that, then they're going to need another person to help them, someone on the other side to help them lift that person safely. And even then, there's a risk of injury. So those are just some examples of things that often are not anticipated. But generally, I can say that when you're caring for someone with a chronic illness, especially if you're caring for them in the home, the things that you need today, the resources and the tools that you need today are going to be different than the ones you need 3 months from now or 6 months from now or 2 weeks from now. And so I'm always encouraging family caregivers, reassess often. What do you need? What resources do you need to be able to do the things that you're trying to do for your loved one?
Yeah, that is so true. My dad had both in-home care, and then we did have hospice care that came in. And you are correct. It did change over time, and we were so grateful to have that support that we could ask those questions and be able to reassess. And you're right. There were so many things that you don't think about until you get to that point of care. And then all of a sudden it's like, oh, well, now we have to learn a new caregiving skill or a new caretaker skill for this next
Yes.
stretch. Yeah. Yeah, absolutely. So Brian, I know, so Brian was with me when we were, helping to take care of my mom, but, like, Brian, do you have any questions? What did you kind of observe, or what were some things that maybe were unexpected for you?
Well, one, Hospice did a very good job, but depending on the nurse that came, um, depended on the level of information that you got. Uh,
Hmm.
they kind of tiptoe around where they think the person is, and that can be helpful at times, but it can also hinder, I think, a little bit. So as things were nearing towards the end, the nurse that we had, again, she was very helpful. She was caring. You could tell she was connected to Lynn and everything, but she wouldn't necessarily give us an assessment. But then on the other side of that, like it's not just the primary care family person that really struggles, because we could see it in Michelle's sister and a little bit in our nephew. They didn't know how to necessarily process it as well. And
Mm-hmm.
you could see the stress level go up in Michelle's sister the closer we got to the end as well, because you start realizing that things are getting worse and be going in the wrong directions. I guess we might tell on that.
Yeah, that's, it's really interesting. And I guess that's actually a question for you that I was kind of thinking about too, is that depending on the family member that you're taking care of, depending on the situation, there are times when it feels like perhaps you experience a certain level of grief, even if the family member is with you, but maybe in situations where they're not expected to recover or not going to recover quickly, or I'm sure there's other situations, but I am really curious about that. Is that kind of normal for caregivers to have some feelings of grief, even while their family member is still with them, and maybe for a while? Just it's
It
unexpected.
certainly isn't uncommon. And in fact, it has its own name. It's called anticipatory grief. And it is definitely something that, and a lot of people experience once a loved one has a diagnosis that is life altering, that they expect that is going to progress, and they know that there's not going to be a cure, or maybe the loved one has made the decision to not seek treatment. And yes, it's called anticipatory grief, where the family members can really begin going through that grief process, where they're feeling all the things of grief, even though the loved one is still with them.
And you think about the implications. So let's just say, our generation, Brian and I, we're kind of firmly in the middle of Gen X. But if you are in the middle of your career and you find yourself in this situation, I think from that employer standpoint, I don't think your work colleagues, or maybe even your managers, I don't think they fully understand the feelings and what's going on during that situation. And it's just, sometimes I wonder if there's just a lack of understanding that you really are going through grief, you're going through responsibility, you're going through tiredness, like all of that, while you're trying to often work a full-time job and then to also take care of a family member. And I'm really curious, have you seen this in working caregivers who are still trying to hold down, like a full-time job?
Absolutely. Well, most family caregivers are working full time. And I think that's something that needs more attention. And there's several organizations at the national level that are trying to bring more attention to that, but we still have a long ways to go. But the reality is that most family caregivers are working. And so I've seen several different statistics. It depends on who you want to believe, but anywhere between 40-45 plus percentage of employees that are 40 or older are family caregivers, and of that 60% are women. they're in the workforce. So trying to work full time is certainly an added stressor. We still have a long way to go with parenting, but I would say we talk more about parenting within the workplace than we do about family caregiving. So a lot of times employers don't even know that someone is serving as a primary caregiver for an ill or aging loved one. So they don't know what's going on in their home life unless FMLA, so the federal time off, or in our state, in Colorado now, as of this year, we also have the Family Act, which allows people to have some paid time off if they need to be away from work and care for their ill or aging loved one. But not every state has that. So we still have a long ways to go in terms of the conversation.
Yeah, and I think there's education on the work side of it as well, because, like you said, they made the employer and the people working next to the caregiver may not realize what they're going through, and
No,
if they're not fully holding their weight, then that just adds additional stress. It's a tough time, and
yeah.
then so you kind of have to. It's like, where do you start that process to get that news out? Because I can see how that would go wrong. I mean, caregiving is definitely the same thing as having a divorce, but it's both trauma. Both trauma, you are so unfocused at work. Any type of trauma that goes along with it, just not divorce or caregiving. You're not
Exactly.
focused, and people can understand, okay, something hurting them for a while, but if they don't have a good explanation or they're not willing to express what's going on outside of work, then there's just their work is going to be that much harder because people are going to have misunderstandings and that eventually they're just not wanting to do the work. So
Exactly. Yeah, I think the fear that some employees find too is they are concerned about sharing that because they are concerned that it will impact their job, or that they might be passed over for a promotion, or that it will have some sort of a negative impact. So there's that balance of yes, it would be helpful if we could have that open discussion inside of companies so that we could know what's going on and be able to support someone when they're going through that role of family caregiving.
hey, Sammie, go for it. Document it.
Well,
Get the presentation going.
I'm looking for a quote here. There's a quote from Rosalind Carter, and I think it's when she testified in front of the congressional committee many years ago on behalf of family caregivers. And she said, there's only 4 types of people in the world. There's people who have been family caregivers. There's people who will be family caregivers. There are people who are currently caregivers. And then there's those who will need caregivers. So when you put it in that perspective, we're all in that same boat. We've been there, we're going to be there, or we're going to need it.
And I think you're both right. I think it's important that we start having these conversations in the workplace and understanding how to support those who are giving caregivers and understand what they're going through at that time. I think I've definitely been in a workplace where I've had colleagues who were going through this with their parents, and you could see how hard it was for them, but you really didn't know, like, what can I do? Or you just didn't know how to approach it. Because unless you've gone through it, you just have such a different understanding of what it's really like. So I think, you point out, that's a really good point. We need to start having conversations in the workplace about how
and
to
for some people, just depending on the situation that they're in, they have to either cut back their hours or they have to leave employment. And that's not uncommon either. We do see that happens quite a bit. And that's where I feel like resources and books like Dan Miller's book, 48 Days to the Work and Life You Love, are really important when someone finds themselves in that situation where they're going to have to look at doing something different. That's a really good book that I would recommend.
That's a really good shout out. And I, of course, have read that book. You and I and Brian, we are all members of the 48 Day Eagles.
Mm-hmm.
And I think that's, I worked in healthcare my entire career up until 2021. And then my husband and I took a sabbatical to recover from burnout. During that year, I was able to help my sister plan her wedding, which was such a joyful moment because my mom was still able to fully experience that. But it was because I wasn't working full time at that point. I had that flexibility. And then again, when with my mom, over the last weeks of her life, we were up there with my parents and we were able to work. We were still working, but we were able to have that flexibility. And I think that for some people, that ability to be flexible as caretakers, it makes such a big difference. Because, for the most part, if my dad needed help, we needed to move my mom, we needed to help her eat, whatever it was, I could pretty much drop what I was doing and just go in the other room and help. So that's actually a really great call out. And of course, 48 Days to Work You Love is an amazing book, amazing community. And it may be something that, as people get into their 40s and 50s, they see this coming, they may need to think about those career shifts and what do I do if I find myself in that situation. So yeah, absolutely. And it's hard. I will say it's hard. It's not necessarily easy to just make that shift. And I'm sure you've seen that. I'm sure that's been a hard shift for folks.
Yeah, it is. It is a hard shift. But for some, that's the situation that they find themselves in. For whatever reason, they either need to step back partially or entirely. And but not working, not having income isn't an option for many of them. And so that's where they have to look at, well, what are the options that can allow me to make some money and either have my own business or work in a different way and still be that primary caregiver for my family member.
So there are options. It's just a matter of finding what works for them, it sounds like.
Yeah, it is.
Yeah.
It is.
So are there, we're talking about caregiving in different contexts. Obviously, you can be a caretaker at home. You can be a caretaker where you're just going to visit, or it could be that a loved one needs to go in a nursing facility. Are there any considerations or factors that people should consider when they're making the decision of what kind of a caretaker role am I prepared to take? Do they need to consider the type of illness? Do they need to consider their capacity? Like, how would you make that decision if all of a sudden you're in a situation where you have a loved one who needs care of some type?
Mm-hmm. When I work with someone as a family caregiver, I like to take them through a pretty specific process for that. And we start by just assessing the situation, really getting the hands around what is going on, what has happened, what is the current treatment plan, who are the doctors involved, what are the medications, what are the care needs. So are there safety factors that would prevent someone from staying in their home? And then we look at, are they able to stay in their current home, maybe with some modifications? Does the family caregiver want them to come and live with them? If that's not an option, or there's additional levels of care that can't be provided in the home, then we look at, is it assisted living, or is it a memory care or long-term care facility? And I help them understand how to evaluate those facilities. There's some online tools that can kind of help you if you're really at that point that you need to look at evaluating one facility versus another. But those are just tools online. And, I always want the person to actually go into the facility, and there's some very specific things that I feel like they need to do when they're making that decision for the next level of care. And part of it, if somebody's going to care for someone in their home, whether it's having them come live with them or they're going to stay in their home, part of it sadly depends on where you live. I live in northern Colorado. We have a lot of great resources here. There is a geriatric primary care practice that will come and see people in their homes. They don't ever have to go to a doctor's office. It's wonderful. There's also an acute care practice started by a physician who will come and see people in their homes. She has nurse practitioners and nurses that work with her, and it's a higher level of care than home health care. So it can keep someone out of urgent care or even the hospital. So I live in an area where that's an option. Now, in some of the rural communities around, that wouldn't be an option. So when you're making that determination of where to care for the loved one, part of it depends on, sadly, on where you live as to what's available. And then there's the cost associated with it. And so many family caregivers assume that Medicare will cover everything. And they don't. They don't cover extended home health care if you wish to continue with that beyond their coverage period. They don't cover non-medical care if you need those services. And they can really add up very quickly, especially if you're needing them 24/7.
Yeah, you're right. Those are a lot of considerations. I'm curious if people know what their resources are. When you meet with families, do they know what their resources are, or do they know how to find them? And if not, how can people go about looking for the resources in their area?
Often they don't know what is available in their area. I encourage people to look for the Association on Aging, Centers on Aging. Every state has one. In our state, we have it by county. So I'm in Larimer County, so there's the Larimer County Center on Aging, and they have a website with resources. I mean, they're a great service, a great resource that gives family caregivers a place to start so they can at least know what is in their specific area.
So that's a great tip. So if they were to go online and just look for, what is it called again?
So it's usually the area center. I'm going to look to see if I have a specific title. It's the Office on Aging.
Office on Aging. Okay.
So if you Google that and then your county, or Google that and then your state, you'll most likely be able to find them. And so it's either by state, county, or city.
That's a great resource. And yeah, I'm betting most of us don't, like you said, we don't think about these things until we're there. So I'm guessing most of us wouldn't be aware of that. So great resource. Thank you for sharing that. Go ahead, Brian. Did you have a question? Putting you on the spot.
Well, I kind of have a question. So the neighbor to one of Michelle's family's house was also at a point in time where they have a family member that probably needs hospice, and they didn't even realize what hospice could provide for them. And so I guess we've already talked about hospice and the things they can provide. Can we go back and just give an overall idea of what hospice do, whether it costs them, whether it's part of the government, Medicare, Medicaid, I don't know which, because I just never have followed that very well. But just some of that, and you speak on that side of it, Sammie, so that people that may be listening and don't realize that hospice is there as a benefit to them can use it.
I've actually said I wish hospice was the standard of care for everyone all the time, because part of the goal of hospice is they are meant to come in and provide all kinds of support to the person who is their patient, but then also to family members. So truly physical support, emotional support, spiritual support. A lot of hospice programs have art therapy and music therapy. They have chaplains that will come in, a lot of different volunteers that will come into, now that things are open after hospice, that can come into the home. But at its core, for someone to be on hospice, they have to have an order from a healthcare provider. So a nurse practitioner or a physician that says they have a severe life-limiting illness that may end their life within the next 6 months. Now, I've seen people be on hospice for a year and a half, and I've seen people be on hospice for a couple of weeks. So that's a physician or a nurse practitioner's best guess at the time. But I think where there's some miscommunication about hospice is when people are afraid that it means we've given up. We're not seeking treatment any longer. And it's a different level of care. It's a different level of treatment, but it's a full family support level of care. Like I said, I wish it was the standard of care for everyone, everywhere, all the time. I wish you didn't have to be at a point where you have a life-limiting illness to get that level of care. But I've worked very closely with hospice. I've not been a hospice nurse, but I've worked very closely with them. When I was a nurse practitioner in long-term care, I worked very closely with hospice staff. And my experience with them, and I realize there are exceptions to this, but my experience with them is that they do amazing work, and they provide so much support to the family and to the family caregivers at a time when they all really need that extra level of support.
Yes,
Yeah.
it takes a special nurse and CNAs and such to be able to do what they do, because you're constantly turning over, you know what the end result is, and that takes
Yeah.
a special person.
Well, coming from my background, my background is adult geriatric nurse practitioner. I have worked with so many patients at the end of life. And yet, I will say this, when my mother was in hospice, I was the daughter. I was not the nurse practitioner. I was the daughter. And I needed a nurse. I needed a hospice nurse, and I needed CNAs to walk me through that process. And I was so grateful that I had.
Yeah, that was our experience as well. And Brian's right. Like, they are truly special people, and just they support you in so many ways. And just knowing that you can pick up that phone and call at any time, 24/7, and get an answer is such a big support.
Yeah. And I did that with my mother. I actually had the physician for the hospice care program on the phone on Christmas Eve at 10 o'clock at night, because I had a question about the medication my mom was on and the side effects that we were seeing. And they were just wonderful. It was amazing support.
Yeah, absolutely. Yep. So Sammie, for caregivers, people who are caring right now, caring for a loved one right now, what support is available for them, and what advice would you give them? And obviously, it's going to be a stressful situation. There's going to be a lot of emotions. Even if it may not be a terminal disease, they may be caring for a loved one who has a very severe diagnosis or who needs a lot of care. So it could be going on for a very long time. What are maybe just 2 or 3 things that you would say to them as far as getting help that they need and recognizing when they need help as a caregiver?
The first thing I would say is you don't have to do it alone, and you shouldn't try. It really does take so many people supporting you to be able to walk through that caregiving journey. And unfortunately, family caregivers believe I need to do this. I need to do this by myself and everything else that I'm doing. And if that's working, caring for a spouse, children, all of the other things, they really do need the support. So the thing that I encourage family caregivers to do when I work with them, obviously we're looking at what are the care needs, what's currently part of the treatment plan, what can be done, what is yours to do, and what do you need to ask someone else to do. And a lot of times that means reaching out to other family members or community members, people in your church. And with family members, I know that can be tough, because sometimes it's bringing together family members who may not have spoken to each other for months or even years, and it's asking them to help. And I realize that can be a very difficult situation, but I encourage family members, the family caregivers, to reach out soon and often for help in their community, to people that can provide assistance to them, and to constantly be reevaluating what is needed now, what can I do now. In terms of respite for them, just that need for rest, even if they are caring for someone in their home, a lot of long-term care, skilled nursing facilities will provide what's called respite care. So someone can come in and stay with them for 2 weeks or so, a week, just to give the family caregiver that rest, and then they can bring them back home. Just let them have a break and recuperate. In terms of just some book resources, there's a couple of really good books out there. One is called Working Daughter by Liz O'Donnell, and one is called The Complete Elder Care Planner by Joy Lavarde. And those are both good resources just for helping look at the whole family caregiving plan. But within the community, there are certainly things online, support groups online, and I encourage people to reach out to those, because sometimes it's easier to be in a group where you can just be on Zoom versus trying to leave home and go to, it's just one more thing on your list if you're trying to go to a support group. But so often family caregivers believe, I'm the only one that's ever gone through this, because we don't talk about it. And it helps to have a support group, whether it's in person or online.
Those are great
Yeah,
recommendations.
that's one thing about Michelle's dad is now that he's gone through the experience and he's realized some of the things that he wished he would have known, he wants to get into his church and have that conversation with the church and, help set up a system to help those people. And yeah, it don't work go with that anymore.
Well, I think what you're pointing out is that, if you've actually been through this, like, what it's like, there is kind of that natural desire to help others. And, I'm guessing that probably some of these support groups started that way, with someone who'd been through it, and now they're volunteering, just like my dad kind of wants to do now, to help others.
I'm so happy to hear that about your dad, Michelle. And I'm going to tell you why. It's because men are often, they're a smaller group of family caregivers. And often when they are the family caregiver, it's because they're caring for a spouse, or their spouse has passed away and they're caring for an adult child or a sibling. But they need the support of another man. So I really believe that he will have a great impact, not only in his church, but in his community, however he wants to serve. I think that's a wonderful thing that he's doing.
Yeah, and that's a good call out, because we tend a lot of times to think of women as the caregivers, but you're right. My dad was the primary caregiver for my mom for that entire time, mm-hmm. and it really became his full-time job. He was retired, so he was the one who took her to appointments, made sure she got the labs done, called the doctor, did all of that. Like it was almost a full-time job, and he did an amazing job. Like, I don't know if anyone could have been more cared for or more loved, during that process than my mom. But you're right. We forget that a lot of times for men, they don't have a lot of people who they're talking to about that or who know about that. So yes, good call out, and we'll make sure we pass that on to him.
Yeah, please do.
Well, Sammie, we're kind of wrapping up, but so 2 more questions for you. The first one is, what are you currently working on that's really exciting to you or that you're excited about? And then the second thing is, how can people connect with you or learn more about what you offer?
I'm currently working on a course for family caregivers, basically taking a lot of the same things that I currently do with someone that I would work with them on one-on-one, where it's a pretty specific process that I walk them through to help them get organized and feel comfortable with the healthcare system, and to evaluate what care is needed. But what I realize is that sometimes people are needing to access this information at 2:00 in the morning. And so I'm looking to create a course. Honestly, that's when it happens, right? You're awake and you need to have the resources that you need right then. And so I'm looking to create a course that would basically address these same things and allow them to have access to that. And I'm also looking at possibly doing a group training for people to have something that several people could go through, similar to the one-on-one training, but it would be in a group setting.
That's exciting. And as we talked about earlier, we are all going to, at some point in our lives, we're going to need to be taken care of, or we will be a caregiver. So those are great resources.
There are only 4 types of people.
That's right. And then finally,
need to be taken care of.
What was that? You're going for the you're going to vote for the one who needs to be taken care of. Okay. Unfortunately, we don't always get to vote.
Yeah.
So final question then is, how can people connect with you or learn more about what you're doing?
Yeah, so they can reach me through my website, which is Vivec Health, and that's Vivac Health. And it's all one word, vivachhealth.com. And I do have a free guide for family caregivers that they can access from my website, and they can also contact me directly through that as well.
Great. Well, thank you so much, Sammie. The resources you provide are so needed. And, now that we have gone through this, I am just so thrilled with the services that you're offering and what you're doing to help caregivers and people who are out there who will be going through this. So thank you again, Sammie. It's been an absolute pleasure to have you on our show today. And we look forward to continued conversations.
I look forward as well. Thank you again.
Thank you, and have a great week, everybody.